Hello everyone, this is Persephone and welcome to Psychopomp. Today we are going to talk about why I think many things about modern psychiatry are scams. Not all of them, but many of them are actually scams, and directly related to AI, I'm going to tell you why I believe that for many people AI can help them a lot more than psychiatrists can. A few things about me. I'm not going to make this video about me. I have autism. I was diagnosed with Asperger's syndrome at 1 year old, and I had seen an endless number and amount of psychiatrists towards my life, both as a child and as an adult. Because of narcissistic abuse from my mother, I've also been diagnosed with CPTSD. And recently I had one autoimmune disorder, and secondly, recently I was diagnosed with a second autoimmune disorder. And I say this because I believe in the theory that a lot of autoimmune problems are related to adverse childhood experiences. I've been reading this book called The Deepest Well, which is a very heavy book from an expert on the subject, a doctor, and she explains why people who actually escaped a very abusive childhood and they went on to build seemingly successful and healthy lives, they ended up with horrible illnesses and they died at relatively young ages, 40s, 50s, and we're talking about horrible, painful deaths. So because I try to not have the same thing happening to me, I try to educate myself and change. And I'm going to talk to you about my experience with psychiatry and why I think many things are helpful, but then extremely serious and concerning, big number of things are also scams. Things that helped me with psychiatry. Thing number one, validation. I had a psychiatrist that straight out flat told me I'm not supposed to diagnose people that I don't know. So I can never say that officially, but between you and me, your mother sounds like a malignant narcissist, which if you don't know about narcissist, is like narcissist on steroids. It's the worst form you can come across. So I was at a time where I had recently escaped my house. I was very young, I left my house at 17, I was 18, and it was very validating to hear a professional and a scientist validating what you already know. Because before that, my entire family was extremely invalidating. They were saying, she's your mother, you have to be nice to her, you have to forgive her, you only have one mother. Or my favorite, if you leave, your mother has only one child and she will not have anyone in her life. Yeah, newsflash, I'm not a rehabilitation center. It's not my obligation to stay back and be abused so that my mother doesn't feel loneliness because she abuses and isolates everyone else who has the right and a way to live here. So when you are exiting traumatic situations and when there have been people around you who have an agenda to brainwash you and keep you in the dark, seeing a psychiatrist or a therapist or a psychologist who is going to validate that what happened to you, no, it was not okay, can be extremely helpful. It can give you the necessary motivation to even try to leave if you haven't left yet, or form an escape plan, or in my case, to stay the hell away. The problem with psychiatry that is directly connected to that is that a lot of the professionals will recommend go no contact with the abuser, and for a very good reason, because no contact sometimes is the only and the best choice, most times. But unfortunately, because we don't exist in a vacuum, no contact is directly connected to the society we live in. So to put it plainly, you need a tremendous amount of money to go no contact and stay no contact. At least in my case, and I'm a very frugal person, I always was, and because of Asperger, I don't want many things. I'm a minimalist because I get tactile defensiveness easily, I get sensory overload easily, I don't need many friends, I don't need extroverted activities like eating out, dining out, going out to concerts and stuff like that. It's so difficult for me. So you could say that I was on the lower end financially and I didn't really need that much money to go out. Here is the problem. When you have been living with abusers your entire life, first of all, you lack specific life skills that are necessary to make money. To put it plainly, for me, I knew nothing about nothing. And I didn't know how to pay bills. I didn't know how to do taxes. I didn't know how you rent a place to stay. I didn't know how you actually interact in several social situations that they are beyond what I already know. So that was extremely difficult. So you're going to fail. You're going to be fired from jobs. Maybe you will have difficulty finding a job. Maybe you won't even have a qualification to find a job that will pay well enough to actually support you and allow you to leave and stay away. And the problem is, guys, that every time you leave, the narcissist actually realizes that, first of all, it's a narcissistic injury. You leave, so there must be something wrong with them, because if they were nice, you would have stayed. Then they realize that you're actually not as stupid as they want you to be, so they have to break you down further. And that is going to make the abuse, when you return because you don't have food or you don't have a place to stay, it's going to make the abuse much, much worse. So it's not like you can have many attempts of leaving and coming back and leaving and coming back. Every time you go back, the danger is actually increasing. So ideally, you have to leave once and stay away permanently, or maybe come back once. Psychiatrists are not going to tell you that. You cannot imagine how many books that I've read about narcissism. I think I've practically read everything that exists, and I'm reading everything that comes out, and no one says that you won't have the money to go no contact, most likely. You won't have the money to stay no contact. Bad things will happen to you. And I say that because I'm not going to expand on adult content on this side. There were many people, because I have filmed adult content, I filmed OnlyFans, the whole thing. I'm not going to promote it here. Psychobomb is not about that. And recently, I had some very bad things happening to me with the autoimmune. And there was someone on the other channel who left a comment, and he said, none of this would have happened if you weren't an adult content creator on OnlyFans, and if you had just married a guy. You really think that you can just marry a guy with no money, with your narcissistic mother constantly interfering, trying to break your marriage apart? I've been there, I've done that. Like my first marriage, there is 90% of the reasons that my marriage fell apart has to do with my parents and with my own unresolved trauma about my parents. So I consider psychiatry a scam in the sense of they tell you what you need to do, but they don't acknowledge that you can't do it, and that in many cases, I'm going to use myself as an example. If I didn't do what I do, if I didn't make money from OnlyFans, I would be dead right now. I would have to go back to her so many times that she would find a way to kill me. She has attempted to kill me several times. And even psychiatrists have acknowledged that, but society says when there is a will, there is a way. If you really wanted to find a vanilla job that pays well enough, you would. I wouldn't. And even if, let's say, miraculously, I was able to find such a well-paying job, I have college education, with my autoimmune, and the last autoimmune that for another diagnosis is pancolitis, it could be Crohn's, it could be ulcerative colitis, it could be a combination of both, it could be more than that. With my problems, when I get up in the morning, because I'm now on extremely high immunosuppressants, which is another problem, but the first days when I was waking up and I was in extreme pain, I couldn't even get out of bed. How would I go to my normal job? Now that I work independently from home, even if I do a job that many people will not approve of, I can stay in bed for 1 hour, I can drink chamomile tea, I can slowly make the pain go away, because one of the problems for me is that I'm not allowed to take any painkillers right now for anything, because they thin the gut lining, they make your gut thinner, and you already have leaky gut. You can look up what those things are, but let's say the painkillers are bad for your gut, so you have to just soldier through whatever pain. You're on your period, doesn't matter. You have a flare and you're in pain, doesn't matter. What kind of employer is going to keep me? So psychiatrists are actually just telling you, you need to do this, you need to do that, and they know. Because I have an ex who is a psychiatrist, and he said, I know these people are going to fail. I know they can't go no contact unless someone miraculously helps them, but I still tell them go no contact. Scam. The second scam that I see a lot of my clients on the adult media is that psychiatrists don't tell people that because you look extremely unattractive, the chances of someone being interested in you are very slim. I'm the last person. I would never insult anyone about their appearance, especially about things that they were born this way and they cannot control. You will never see me going to anyone's YouTube channel to leave insulting comments about their weight or their height or their age. Never. But when you go to a therapist and you actually want help, the therapist has to tell you, for example, that I know many men, that the women that they want, they're so far out of their league. So the therapist has to tell you that you have to lower your standards or you're going to die alone. Or I really hope that there are going to be therapists that they are going to be open-minded enough to promote relationships between human and AI, and eventually relationships between human and robots. Because the chances of a 50-year-old man who is very overweight, he's out of shape, and he doesn't have a lot of money, to find a 25-year-old cam girl style girl that he wants, that is very sexy, and she is this Latina girl named Sabrina, which is her stage name, and she's wearing sexy dresses for him. Yeah, no girl is going to want you like that. So the therapists are going to say, just go out more, just be more friendly, and just make the first step, and women will want you. They will not. And also that has a second side effect. I was contacted, before I started being like brutally honest about these things, I was contacted by so many delusional men that we had nothing in common, and they just saw me online and they just saw, okay, I want to date this person, and my therapist told me just make the first step, and then they get upset why it doesn't work. So I'm going to give you a small dose of reality here. Pretty young women want handsome young men around their own age. Or if they're going to date an older guy, the guy cannot be like many decades older, and he needs to be well off. Well off in the sense of, if there is a woman who is young and she wants to start the family right away, she may look for a guy who is, let's say, 8 years older and he has a good job, so they can get married and she can have children and she doesn't have to worry. But is there any woman that is going to date the guy 30 years older and unattractive just because of the money? The woman isn't going to want you. She's just going to be using you for your money. So that's not what you want in your life. A lot of psychiatrists are very either blue-pilled themselves, like they don't understand how the world works despite their advanced age, or they just don't want to rock the boat and say unpleasant things to the patients because they're going to lose them. For example, another thing that I have a problem with psychiatrists and doctors in general is that they don't talk about nutrition, they don't talk about lifestyle changes, they just push medication right away, or they just shy away from all of the important topics. For example, I knew a girl that she had polycystic ovarian syndrome, and she was very overweight and she had many problems with her health, and she went to a doctor who sent her to a psychiatrist, and both doctors agreed that she has to start metformin right away, which is a medication to help with the problem that she has, which is great. But no one ever told her, what do you eat? How do you exercise? Do you have toxic relationships around you? I think both of her parents are narcissists and she's in extreme denial about it. So they just put her on the drug right away. And there was no talk about her terrible eating habits, eating takeout, sitting around all day, not working out, starting and stopping. This is not medicine. This is just, I'm just masking the symptoms and going to the psychiatrist who is just giving her antidepressants when her parents are honestly monsters. And the psychiatrist knows that he can get her out of there, and he's just giving her things to mask her symptoms. Eventually, all of this medication is going to kill her. And you're going to say, why are you a conspiracy theorist now? Antidepressants don't kill you. You're right, they don't kill you right now. But aren't you going to probably develop autoimmunity from adverse childhood experiences 10 years down the line, 20 years down the line? And your liver and your kidneys are constantly bombarded with chemicals that they have to break down, and your body is constantly malnourished. A lot of psychiatrists that I've been to never gave me any advice besides the absolute basics. Oh, you're not fat. What do you eat? Okay, you're fine. I was not fine at all. There is no holistic approach whatsoever for most of them from my experience. And they push meds insanely. Like, I'm not against medication. If, for example, you lost a relative and you're experiencing extreme grief and you need medication to get through the day, of course, go ahead and help yourself. But when there is absolutely no other change, and you're just overly medicated like a zombie, and you become dependent on these medications. My narcissistic mother had made me dependent on Xanax. Oh my God, guys. To get off that stuff, it was like a rehab experience. It was one of the worst things I've ever experienced in my life. Nothing changes if nothing changes. Just taking a bunch of pills and pretending you feel fine when all of your awful life remains awful, it's not going to help you. But they're going to buy a second house with that. They're going to renovate the clinic with that. So they're going to do it. Another thing that is extremely bad is that most of them are extremely closed to new ideas. Like, I also got a lot of comments from people who say that this is sick, what you do is sick, that I even had psychiatrists who tried to prevent me from starting things that I wanted to start because they said it's too stressful for you, and it was so unprofessional if you ask me. I had even psychiatrists who I could tell they don't believe in me, and I had a woman that I really regret that I wasn't experienced enough to just file a complaint back then, and after that I couldn't find her, that she told me that you need to change because you are stressing your parents with the things that you do. So I'm the one stressing my parents. I'm the one that I'm trying to, excuse me for trying to escape emotional, physical, financial, sexual, spiritual abuse, like any kind of abuse that you can actually think of, that you can actually name. I was experiencing in that house. And I'm the problem for living, right? So another point about them is that a lot of them are actually narcissists and psychopaths themselves, because it's a profession that gives you a lot of things that cluster B personality wants. They give you supply, money, status, and access to very vulnerable people, access to people who have already been victims of other abusers, and you can easily manipulate and even destroy. I had someone from Night Flirt, from one of my adult media, who told me that when he was in his early 20s, he went to a much older therapist in her 40s, and the therapist started an inappropriate sexual relationship with him. I was actually so shocked. And he didn't know. He had very poor boundaries back then. I mean, when you're 21 and the other woman is 40 plus, she obviously has the upper hand and she's in a position of authority. And eventually, when he found a girlfriend in real life, the therapist discarded him. She said that she's very disappointed. She wants nothing to do with him, and she went no contact with him. She fired him. And that is so traumatized that the person is now much older, and he is still affected by that up to this day. So it can be so dangerous. I was devastated when I heard it. Like, oh my God, it was a female sexual predator, guys. So I'm not saying all of this to make people like skeptical or phobic of therapists or psychiatrists. No, because therapist and psychiatrist is not the same. And I don't believe that dating robots or talking to AI can solve all of your problems, although it solved many of mine. So I'm going to say that if you have problems that you have tried to solve many times on your own and you couldn't, usually it's some trauma or something deeper going on. So I really encouraging you trying to talk to a mental health professional. If you're like me and you don't like having to go out a lot to like new places or having to go there and be seen, you can do online therapy from your house. You can book an online appointment. And sometimes you may need to try 2, 3, 4 people to see which one works for you. And be careful for the things that I told you. A person trying to control you, saying things that are very inappropriate or outright wrong. A person trying to over-medicate you right away and not respecting your wishes if you don't want medication, or if you don't want medication right away at least and you want to try other approaches. You go to a person for a few months and none of the things that they say work for you. You have tried them. Like, for example, about the unattractive guys, that the psychiatrist is not going to outright tell you that your weight is the problem or your looks are the problem. But they're going to just tell you, keep going out, keep talking to women. If you follow that advice and you talk to 50 women and you're just labeled a creep, it's time to change therapists. And maybe you need a life coach, or maybe you need someone who does like other types of therapy that are going to be more effective for you. And overall, trust your intuition. A lot of the times people will just try to invalidate you, and if it's a psychopath or a narcissist, they're just going to make you dependent on them. I know that there are immoral psychiatrists and immoral therapists, that they tell you what you want to hear, and there are people who say, oh, I've been going to therapy for 8 years, oh, I've been going to therapy for 10 years, and that's mind-blowing to me because they never achieve anything. Their life is the exact same, so why are you going over there? Because obviously there, people just tell you what you need to hear, they stroke your ego, but nothing really gets resolved. So just be careful, have your eyes open, and I think that eventually you are going to find someone to help you. And please, if you have abusive people in your life, don't tell them that you're going to therapy. They're going to try to stop you any way they can. It's very interesting that my narcissistic mother, after I left, she was extremely against me seeing psychiatrists on my own. Even now, when I was diagnosed with the second autoimmune, and I got a recommendation from a doctor, like a family doctor that I really know and trust, about a psychiatrist that I wanted to go to discuss my autoimmune problems, because I had a near-death experience at the hospital and I experienced a lot of medical abuse in the hospital looking back. So I wanted to discuss with a professional, and I mentioned that to my narcissistic parents because I'm extremely low contact. Unfortunately, I had to go to break no contact, to be extremely low contact because of reasons that I haven't mentioned in the other channel yet. And my father was furious. He said, no, you should go to our psychiatrist or not at all, to the one we both go. Why? What is the difference? Because probably that person is such a corrupted narcissist like you too, and they're going to be telling you what I say in the sessions. And I said to my father, that's not going to happen. Like, I'm past the point of apologizing, defending, or explaining.